Hi everyone, my name's Abigail. I'm a therapist, counselor, psychic medium, and today I want to talk about adult children with substance misuse and whether or not you should go no contact with them. This is a very tricky subject because what I know from my clients is they're so afraid that their child will let's be upfront, do something fatal if they're not in contact. So they have this need to constantly be reassured that their child is safe. And so I think, look, this is going to be my advice, and obviously it's up to you to weigh it up against your circumstances. But I'll tell you my thoughts on it and why, and you can go from there, because I think it's incredibly draining and difficult to be a parent of a child with substance use, and whether that be a teenager or a child in their 20s or 30s, it weighs very heavily because often there's a story around from the child, most often, of you did this and you did that. If you hadn't done this, I wouldn't be like this, because they don't take responsibility for their habit. So someone has to. And quite often when they're trying to sort it out in their mind why they have this problem and they're not ready to take personal responsibility for their life yet, they will need somewhere to anchor the responsibility to understand how they got there, and that will be you. So it's not necessarily a bad thing, but it's also an incredibly difficult thing, because as a parent worried about the life of the child, what the parents tend to do is take that to heart, question themselves, and do find places where they could have done it better. So it's a really, really difficult situation to be in, because then what they do is they're continually like, well, how can I make it up? How can I make it up? But what I would need you to know is you can't make up for anything you unintentionally did in the past that this person who's not taking responsibility wants to lay at your feet. Like, yes, you can say, I could have done this better, I could have done that better, but I'm sure if you knew better, you would have done better. So, you can own that. But what happens is people generally get caught in this loop of really tricky emotions around, will my child survive? What could I do different? How do I respond? And they're on edge waiting for phone calls in the middle of the night and all the rest of it. So in this video, what I want to talk about is whether you should go no contact. It's a really, really difficult situation. So I'm very spiritual. I've worked in behavior for a long, long time, but I'm also very spiritual, and I see the progress of the soul as something that we probably need to acknowledge more in mental health. And, one of the things I would say is okay, so let me go back a step. When my practitioners were having any difficulty with their clients, I would always say to them, or help them to understand their place and their role. So their role is not to take anybody's life journey away from them. No matter how horrific the client's experience may have been, they don't have a right to take that away, because on the other side of that, hard as it is to say, there is growth and golden light from a spiritual perspective, and there is a sense of strength and capacity to live in a new way that's probably never been done in that family before. So I didn't give them a spiritual context, because in the traditional workplace setting, you can't really go there unless it's religious in some organizations. Anyway, so I would help them to understand that you don't have a right to take this away. That's their story. What you need to do is be alongside them and support them to work their way through the tricky emotions that come up. So you might only be one piece of a puzzle, and it might take 7 other people to come along and give exactly the same messages that you're giving, and give them succinctly, clearly, and consistently about what might be in their best interest and how they can move forward. But you've got to see yourself as part of the puzzle. You have a responsibility. That's what I say to my practitioners. You have a responsibility to use your skills, to continue to build your skills, to be present and be acknowledging, to be reflective and to be understanding. You don't have a right to take that experience away. So in that way, you have to be strong, centered, have really good supervision, and be able to hold the light for the client so that they can hopefully step forward. So let's go back to the parents. So in my view, in my experience, and in my knowledge, spirits, people do come through with this lifetime to have this experience, even though we might think it's horrendous. And our spirit at our first breath connects into our heart, and our spirit comes into our body, our essence of who we are. But when we have trauma and we don't integrate our experiences of life very well, because it's so difficult, we're up here in our head and we're not in our body, we're not present, we're not in our senses. So what I would say to parents with adult children, they're not in their senses, they're not connected to their heart, they're nowhere even close to it, and they're not about to be till they get rid of the substances, because you cannot be connected to your heart while using substances. You just can't. And I'm going to say it, and I'm not a medical person, so, you go by your doctor, but if you're long-term using medication as well to dull down your senses in your body, you're not going to be able to connect to your heart adequately. I'm not telling anyone not to take their medication. I'm saying go to your doctor, but that's my view. So what I'm saying is, if you're a parent and you're at the point of making this decision, I feel like one of the most important things is that you then make the decision a little bit different. Instead of saying, should I go no contact? Why don't you go contact with yourself? Why don't you do everything that you can in this world to get back in contact with yourself, to get back heart-centered, to get your mind, body, and emotions settled, to get yourself so that you're centered and your heart is in your body, that you're thinking and reflecting and making decisions from your frontal lobe, not from flight, fight, freeze, or fawn and fear of what could happen and the old ways that you have of responding to this child. What if instead of going no contact, well, you can go no contact, but at the same time, what I would say, if you're exhausted from the whole journey, is give yourself time out. And if you need to let your child know that you're going to do that, then you tell them that you're stepping out for the time being because it's exhausting. But then you have to step into you. So what does that mean? That means that you do everything possible to nurture you, to work through. Families hold traumas, and the trauma of the person having the substance issue affects everybody, and it takes a lot of strength for a parent to hold their position. So what I would say is, do everything you can, mind, body, spirit, to get yourself centered and healed and as strong as you possibly can, and get your spirit back in your body to level this family out. I'm not saying you're responsible for the whole family, but I'm saying there's got to be someone who steps up and steps in. And it's not enough to do it the old way anymore. It's just not. You're just going to fall back in the same patterns. But you can, while you might step out of your child's life physically, you can step into their life spiritually. You can connect your heart, the frequency of the heart. Look, it's well documented. You can connect to their heart. You can visualize every cell in their little heart lighting up and being full of love and full of all the goodness that it can possibly be. You can focus your heart into theirs, and you can do that if that's comforting to you. And it might be tricky for a while, because you've got to let go of all the old emotions too, like the guilt, the shame, and the harsh self-judgments that you likely have, the thoughts about what you feel about towards your child, and all the worries and the concerns and the grief and the loss of them not going where maybe you would have wanted them to go. The responsibilities, if they have children and you've had to take on the children, if they're irresponsible with their life and you're constantly picking up the pieces, it's exhausting. Give it back to them. Give it back to them. They need to have chances to succeed, and they're probably going to do that when they have to draw on their own resources. These people These adult children who are substance users are incredibly resilient. They've got so many strengths that you don't even realize because you're always caught up in the fear. They're so resilient. They're so good at networking. They're so good at being reflective and trying to understand, and they get deep interest and they get insightful. The problem is, and this is something that you might need to learn too, is it's really good to understand feelings. The next step is to feel those feelings so they release from your body. So if you're taking time out to stand with you, then you probably need to be doing this work. It's not enough to go to counseling and talk therapy. Like, yeah, you'll get some movement, but it's absolutely not enough to move the years and years of stored emotional energy that you put into your body that doesn't allow your spirit and your presence to come into your body. It keeps you up here in your head, worrying, stressing, being really busy. You have to have quiet. You have to have peace. You have to be able to hold yourself so that your healing can flow outwards. So it means going to alternative practitioners. It means learning to breathe. It means learning to manage your thoughts. It means releasing, feeling the deep emotions that are held in your tissues, in your body. Let me give you an example so maybe you can understand, because a lot of people, this is a really foreign concept and they don't really get it. If you are angry at someone and you don't say the words, anger's an intense moving emotion and it's likely you'll get a sore throat. If you don't process your grief and loss, chances are it will reside in your lungs, because that's where grief and loss resides. Chinese medicine will tell you anger resides in the liver, fear resides in the kidneys. So if you, and its emotion is energy. Like, everyone knows that love feels different from hate. Hate, like, let's even get rid of it. Love feels different from fear, and you know that because it's emotional energy. So imagine the fear. When you're on a fearful day, you're storing that in your body. That's why it can keep coming back up into your life, because it comes up when it's triggered by vulnerabilities that happen. Something makes you scared, deeply scared. You've got all that stored fear in your liver, in your kidneys. It'll come up, and then there's all the life essence that flows through the heart, liver, kidneys. So I hope that makes some sense. But it's really, really important that you get in touch with your body, your mind, and your soul, and be as strong as possible. Because, you know, I am a fan of counseling because it gives you new meaning. But you didn't talk your way into this situation, so it's very difficult to talk your way out of it. So what I'm saying is, if you're going to make a decision to step out of your child's life, which is, in my book, it's okay, as long as you are, if you feel you've done everything and you're exhausted and you need that time, you need to step into your life. And what that means is you need to start prioritizing you. Because, kids, even when they're big kids, they still look at what you do. And if you prioritize you, they learn to prioritize them. They don't learn their value by you caring for them. They learn their value by you caring for you and them. So I hope this makes sense. I have a lot of, I do a lot of coaching and counseling and therapeutic energy releasing, emotional energy releasing sessions from the body. I do it via video. If you'd like a session, or you have any questions or anything you'd like to know, then please get in contact. And look, if it's not for you at this time, then it's not for you. But if you're at the point where you just can't continue anymore, then, and some of the sessions I do with people is they're so, last point, they're so frozen by the fear of their child dying. Am I allowed to say that on YouTube? But no, they're so frozen. So I think it's important to release some of that fear, because then you can make plans. You can know, where's my child? What support services do they have? What support numbers do they have? What safety plan do they have in place? When are they most at risk? Where are they usually located? And then you, rather than being frozen, you make decisions and you make plans that are based in reality. So that's some of the work I have done a lot with clients, is working through that emotional energy of being trapped in that fear of what if, what if, what if. Okay, thank you.